The capacity of mentalization is a social cognitive capacity, which both entails developmental and relational factors. Because of it, most good psychotherapeutic models, in one way or another, seek to activate this capacity in patients of any age. The motivation behind MBTC is to provide a cohesive clinical model based on theoretical integration that produces an organized model of work with children in the school age and their families. This last bit is very important. Our work with parents is central to the clinical model presented in our book. Mentalization refers to the social cognitive capacity of looking at ourselves from the outside. That means our facial expressions, our body, our tone of voice, and everything that infant research shows that is vital and essential to create a relationship with somebody. And of course, what is being said, what we say to each other. And at the same time, simultaneously, as we're looking at each other from ourselves from the outside, we're also inviting to imagine the other one from the inside based on what we see and also what we know of that person. So mentalization, you see, is quite a complex social cognitive capacity that is developed throughout our lifetime and that it gets impinged upon by stress and dysregulation, emotional dysregulation. So our central focus of our clinical approach is in the importance of establishing safe relationships that promote the improvement of emotional regulation in children of school age and the people that take care of them. And that includes not only parents, but also allied professionals and school professionals. So in a sense, MBTC is an approach that is developmental, relational, and systemic. So what are some of the theoretical basic tenets that influence our clinical work? Okay, for example, we know from the literature in neuroscience that there are 4 dimensions that they are balanced. Our capacity for mentalization improve. What are those 4 dimensions? Self, other, internal, external, explicit, implicit, and one that is very important, affective and cognitive. In our work with children and their parents, we're constantly trying to pay attention to those 4 dimensions. The value of this approach is that it's influenced and also it is informed by all the years of research that we have in infant research and how it can help us understand the center importance of the quality of the attachment relationship and how it determines how individuals respond to each other and also how they manage their emotional regulation using their own resources, but also co-regulating with another person. So in MBTC, the therapist has quite an active stance and is constantly trying to work on those 4 dimensions and offer a different way of responding to the child in a way that the child can start opening up to new possibilities in the way that he or she or they use the help that is offered by the adults and the systems around them. This is particularly important when we're talking about relational trauma, because children that have been exposed to chronic experiences of relational trauma basically don't have that openness to learn from another and don't also have the capacity of observing themselves from the outside because they haven't had that experience enough. They haven't been in the mind of their caregivers enough for them to imagine that someone is trying to think about what they're feeling or thinking. Our second edition really focuses on this topic and expands the way that we work with relational trauma from an MBTC perspective. The second thing that our second edition does is expand the way in which we work with parents. Already in 2023, we published another volume by APA focusing only on the working with parents. And in it, we already mentioned the importance and the value of using video intervention as a tool to be more effective, particularly in environments that don't have a lot of resources to offer weekly psychotherapy to parents. And so in this second edition, we highlight 2 things. One, the importance of psychoeducation from an attachment perspective and from the neurobiological perspective, so that the parent can develop more realistic expectations about themselves and their children. And secondly, we give some examples of how to use video intervention as a methodology to accompany parents to really, literally, and objectively observe themselves from the outside as they are accompanied by the psychotherapist and learn about the rhythm that they develop with their children and how to improve the capacity to receive what the child is sending and to return the same message in a way that the child can handle it. In this way, you can hear the echoes of work like the Harvard Center for the Developing Child, the serve and return patterns between children and their caregivers in the first 5 years of life. So in MBTC, we offer a clinical model that integrates developmental psychology, developmental psychopathology, developmental psychoanalysis, and neuroscience all together, wrapped around a very systemic and relational approach to working with children and their families. So we look forward to continuing our journey in being in collaboration with the American Psychological Association, and we look forward to your comments and input about this second edition. Thank you.